This short video is about how to write a summary statement about a virtual patient. So first of all, what is a summary statement? Let's start with an example. This is a student's summary statement about a virtual patient with pneumonia. Mr. Miller, a 70-year-old man, presents with acute onset of high fever, dyspnea, and productive cough. On physical exam, he's in a poor general condition and auscultation shows bilateral late crackles. So, what is a summary statement? It's a kind of synthesized 1 or 2 sentence summary about a patient. It's a transition of a problem list, and it's based on what you know about a virtual patient. And very important, it's data interpretation rather than just repetition. So why should I write a summary statement? It helps you to reflect about a virtual patient and it helps you to practice deliberately. Also very important, it guides the development of the differential diagnoses. And outside of the virtual patient world, it helps you to communicate your understanding of a patient to others, like for example your colleagues. So when should I write a summary statement? Ideally, you should write it throughout a virtual patient scenario and refine it whenever you have new information about the patient. But you definitely should do it before assessment and planning. What should a summary statement include? Basically, it should include the most significant and relevant features of a virtual patient, including, for example, any epidemiological aspects like age, gender, risk factors like, for example, long-distance travels. And it should include key clinical findings like the symptoms of a virtual patient, the test results, or findings on physical exam. For a good summary statement, it's important to use medical terms. For example, use hypertension rather than blood pressure of 160/100. You should also try to use semantic qualifiers. Semantic qualifiers are opposing and often paired descriptors. You can have semantic qualifiers in different categories. So you have the onset of a disease, then you have acute versus chronic. You have the duration or course of a disease. There you have, for example, constant or intermittent. You have the location, for example, of pain. Is it upper or lower? Is it unilateral or bilateral? With the quality, is it hot, cold, liquid, solid, stiff, flexible? And you have the severity. Is it severe, mild, increased, decreased, and so on. Why is it so important to use semantic qualifiers? Well, it helps you to develop the differential diagnosis. For example, relevant diagnoses for an acute versus chronic onset are usually very different. And finally, what I personally think is important to include the patient's name into the summary statement. Now back to the example. If you take a closer look at the summary statement, you can see that many of the aspects I've mentioned before are included in this summary statement. The patient's name is there, the age is there, semantic qualifiers are there, like for example acute, high fever, productive cough, bilateral crackles, and so on. The student also used medical terms like for example dyspnea. Now I hope that this little video helps you to understand the importance of summary statements in virtual patient scenarios.